Hello friends, welcome back to our hair loss treatment show, episode 17. Today we are talking about post-COVID-19 hair fall. As you all know, it's COVID-19 going on right now, the pandemic is going on, affecting a large amount of world's population very rapidly. So as we are passing through this pandemic, there are different manifestations of COVID, multiple sorts of it, we are not going into that detail. But many of our patients have started complaining of hair fall, profuse hair fall, after recovering from COVID 19. So, whether it is really related to the illness or it's just a coincidental finding. No, it is related to the illness. So, COVID 19 is one of the systemic illness. It affects multiple systems of our body. Apart from it affecting our lungs, it also sometimes affects our gastrointestinal tract, sometimes our kidneys, skin, brain, and multiple other areas. So, depending upon how severe a person's COVID 19 illness was, depending upon that, the person may notice some hair fall after the recovery from the illness. Now, surprisingly, here, the hair fall doesn't really start during the illness or immediately after the illness. Patient usually complains of noticing hair fall after 1 or 2 months or 3 months of recovering from COVID 19. Then, how come it is related to really the illness? Now, this is particularly called as anagenifluvia. What happens here is, whenever a person faces any type of illness, here it is COVID, but sometimes even with typhoid, dengue or any other major systemic illnesses, the hair follicles, now in normal situation, hair follicles keep on getting a continuous supply of nutrients through our normal day-to-day living and day-to-day eating habits and other things. In case of these major illnesses, body comes in a situation of prioritizing that which organs body need to take care and which organ can be left out for a while. And hair being a non-essential organ of body is always last on the priority. So during this illness, body has to prioritize that which organs it needs to take care first. So body takes care of your heart, liver, kidney and other important organs, and hair being a non-essential organ is last on the list. So hair stops getting enough supply of nutrients and essential raw materials for their growth during the illness. So it's a kind of shutdown to the hair. Without all the supply being available, hair stops growing at that point of time. But it doesn't really fall at that point of time. The hair roots, they are alive there. It's just that they have stopped growing. After recovering from the illness, and when you start getting new supply of nutrients, a new hair starts growing out of your hair roots. And that is where it starts pushing all the dead roots which were lying there, and it starts pushing them outside. So then, suddenly, as all these new roots are growing all at a time, all the dead hair, they start falling all at a time. And this happens usually 2 to 3 months after the illness. So after 2 to 3 months of the illness, you start noticing profuse hair fall, which is happening just because there is profuse amount of hair regrowth happening inside your scalp skin. Most of the hair that you are losing, you will eventually grow back. All that you have to see is that you give them enough supply of nutrients for all the hair to grow at once. So in this situation, even if you don't do any treatment, you will eventually stop the hair fall and eventually they'll grow back. But if you do treatment, you'll be able to have a healthy and faster hair regrowth as compared to without any supply of nutrients. So the treatment line here to prevent this profuse hair fall and support the hair new regrowth is vitamins, mainly in the form of supplements, and PRP plasma injections. As we discussed in previous episodes, PRP, platelet-rich plasma, is a supply of growth factors. So when you are injecting those growth factors to all these newly growing roots, with the background supply of nutrients available to them, you are actually strengthening the roots and helping them to grow healthier and thicker hair out of these hair roots. So PRP treatments, they do work with your post-COVID hair fall. Nutrient, vitamin supplements, they do work with your post-COVID hair fall. So just in case if you have profuse hair fall, don't just neglect it. Try to seek some treatment so that you can again regrow whatever you have lost. If any questions regarding this, please feel free to write to us. Thank you.